welcome to another session on talk show on legends in neurology. I'm Dr. Jayanti Mani. I'm a neurologist at Kokilaben Hospital, and today we have the pleasure of talking to none other than Dr. Pravina Shah, our teacher and a great neurologist, one of the legends in women in neurology, and who has inspired so many young neurologists. So we're really looking forward to this conversation with her. Ma'am is a great conversationalist, so I'm sure we're going to have a nice time talking to her. And in this journey with her, I have another very young colleague and friend with me to interview her, and that's Dr. Sangeeta Rawat. She is herself had a long journey in KEM, and in fact has been the head of neurology for so many years after Dr. Shah, and is currently also the Dean of KEM Hospital and GS Medical College. Welcome, Sangeeta, and welcome, ma'am. And we're looking forward to a nice conversation with you. Over to you, Sangeeta. You want to start off?
Yes. So I think today we are going to really have someone, a very prominent personality in neurology and in epilepsy, I should say. And I know her as a wonderful human being. So I'm going to see that I and Jayanti together bring out all the aspects of ma'am's life and what teachings and learnings we can have for us as well as the young neurologist whom she has inspired so many years together. But there are still many who don't have such good teachers and such good orators who are guiding. I and Jayanti were lucky to have her in our life. So, ma'am, to start with, I want to start with your childhood. So, where you were born, where was your school, who were your teachers whom you liked, the school memories which you would like to cherish with us.
Yep. First of all, let me tell you, I'm feeling very happy to be interviewed by two of my best students. That's
Thank you, ma'am.
And really, it would be nice talking to you. Of course, we've been talking a lot earlier, but this will be a very nice thing. Well, my childhood has been very comfortable and very inspiring. My father came to Bombay at the age of 14 to earn. He borrowed 3 rupees for ticket from somebody. Started life on footpaths, slowly progressed with his hard work, sincerity and honesty, and had a small jewelry business then at Buleshwar. Got married around 25. My mother was also extremely, cultured person. And both of them encouraged me a lot as far as my education is concerned. My father, of course, had a dream to make me doctor even before I was born. Once he had very sick, no money to bring doctor. Some neighbor called a doctor who treated him even if he had no money. So he was really impressed. I remember when I was 6-7 years old, or maybe 9 years, I think, he had taken me to a doctor to see him. And I still remember his name, Dr. Acharya. So right from 3rd, 4th standard of schooling, it was like on my head, I should be a doctor.
Ma'am, were you the oldest child?
Pardon?
Were you the eldest?
I was the eldest. Out of 5
how many?
siblings, 5. 4 sisters, 1 brother.
Okay. So no wonder he had the dream for his oldest child, and then he wanted to make his daughter a doctor. I think that itself speaks volumes.
And he didn't even know the English. He had studied only 7th standard. But he was a very visionary. For his age, for his era, he was very open-minded. In my community, no one even goes to college, those days. Well, he was ready to make me doctor.
So you were, madam, from Gujarati medium, and your English is so fluent. So people should not, we had that time vernacular medium, so have a setback, but that should never come. I think the way you are speaking English so well today.
I think the credit goes.
And ma'am writes very well too in English.
Yeah.
People who don't have handwriting is another really, like, even now, it looks like a 15 or 20-year-old. It's so beautiful.
Absolutely.
Yeah. Ma'am, you want to tell us about that?
Very good to start with.
Okay.
I read autobiography of Gandhiji when I was in 4th or 5th standard in Gujarati, and he had written that that his handwriting was bad, but
Yeah.
if he wants to improve, they should improve from childhood.
Right.
Writing. So I had a Gujarati teacher who had a very nice handwriting. So I told her, I want to make my handwriting like yours. So she said, come to, on the recess, come to me. And she used to make me overwrite and overwrite on her handwriting.
Oh, so that's the secret of your good handwriting.
Yes. And of course, wonderful teachers. Now, another teacher whom I would remember is Pravina Shah. She was a deaf teacher.
Oh.
It was English. And she used to spend extra time for me. Like, give me a lesson in the evening. Morning, she would come 15 minutes early to check my lessons, to see that my grammar improves.
So you were a special student, it looks, ma'am, always.
Yeah,
Everybody
I was, because
gave
I
you
used to stand
extra
first.
attention.
And maybe
No,
a
I used to
favorite
stand
student.
first all the time in all divisions.
Yeah, so a first student, the one who is always, topper of the class is always favorite of teachers. I think.
Yeah, but this was with love and affection, not with like tuition and money and all. Huh?
Absolutely, yeah.
So then, actually, when I was 9th standard, she made me even a member of the USIS library. And one day she tells me, go and read the life of Albert Schweitzer.
Ah.
Now, that time,
Missionary and
Albert
doctor.
Schweitzer and what man he was and Nobel Prize winner. I mean, it was great. When I left the school, her advice was, don't keep a friend who knows Gujarati. Keep a friend who doesn't know Gujarati, so they will automatically speak in English.
English, yes.
So did you find such a friend?
Yes, I did.
You did.
Her name was Durga Wadhwani. She was Sindhi, and then later she's become engineer, and now she's in US.
Okay.
Oh, okay.
That's it.
So ma'am, tell us then, after your schooling and all that, about your early medical education and how you got into medicine and then neurology. What inspired you to do all this?
Well, I was in Jain College for first year science, inter-science. Inter-science, I worked very hard because my father already had thought that I should go to GS Medical College.
Okay.
So to get into GS, you have to have a good marks.
Yeah.
Fortunately, I had good marks and I got the admission on day one in GS Medical College in 1963. And then, of course,
who inspired you through MBBS? And then why did you take up internal medicine?
Dr. Manu Kothari, I think, teaching anatomy, was a wonderful teacher and wonderful human being. That was the first word impressed me a lot, that before you become a doctor, you be a first good human being. That was his way of thinking. Then we had Dr. Ashok Vaidya, who was my pharmacology tutor. And then he always said that do a coordinated reading. You go to and see a mitral stenosis in the ward, come back the same day. If you find some extra findings, then go and see the patient next day, so that you don't miss a single finding. I mean, this is kind of back and forth, from book to wards and ward to book. I think it's like just following the William Osler's famous quotation. That is something which has made me good student throughout my life, whether it was medicine, neurology, anything. I finished my MBBS. And one thing I can tell you, during my MBBS, I used to like psychiatry a lot. Even as my, did my term, elective term in psychiatry. Then MD medicine. Now, after my MD medicine, after MBBS, what to do? So I chose internal medicine.
So Dr. Nariyalwala or someone you had,
I remember my first house
about.
post was under Dr. Firoz Nariyalwala.
Okay.
And what we have learned from him in terms of good patient care, documentation, and disciplined about everything as far as the ward work is concerned, prescription writing is concerned, notes are concerned, everything has to be up to date. He would ask us reports of every patient 6 in the evening, and we have to be ready. He had divided the patient into acute patients and chronic patients, because acute patients, we have to report him. That time there was nothing like ICUs. Acute patients were also in the wards. So we have to report to him all the patients at 6 in the evening sharp. And all the time concerned about the patients. That kind of a person, difficult to find.
So,
I'm still in contact with him. Unfortunately, his services were terminated by Municipal Commissioner of KEM Hospital. He had to leave the country. He went into he settled in Adelaide at Australia. But I still sometimes receive a letter from him. And
really?
I talk to him. He's
Wow.
93 at the moment.
I remember, madam, now that which you have taught me, as a dean's address, I say this same thing to the students. Okay, whatever you see in the ward, go and read about it in the evening instead of only doing the MCQs at NEET. So that has come from you, madam. I do this. I tell the same to my students also now.
Oh,
So, madam, what inspired you to go to neurology?
Yeah.
Well, after passing MD medicine, I really didn't know what to do. But during my MD medicine, I had a neurology registrar's post.
Okay.
Because since I didn't get a medicine registrar's post, I took neurology post. Because it was believed that whoever does neurology passes MD medicine first attempt.
So,
Because the long case is always neurology.
Long case is neurology.
And that is how I went to the neurology.
Right.
Everybody had scared me that time. About Dr. Monkar. In fact, when I started the post, on day one, people started asking me in the quarters, how was your day? How was your day? He was considered as a terror, but over my experience of so many years, I feel he's more like a coconut, maybe hard from outside, is very soft at heart. He knows how to get work done, but at the same time understands you very well. So it's a wonderful personality and astute clinician, I would say. And Dr. Bharucha, of course, real gentleman who also taught us how to be a good human being. So all these things have really, impressed me a lot. So when I finished MD Neurology had just started by Bombay University. And Dr. Bharucha asked me to register. Initially, I said, no, sir, neurology is a very nihilistic branch. There's hardly any treatment, only diagnosis. We can't do anything for patients. Then,
is that why you took epilepsy, ma'am, then? How come you came into epilepsy?
Yeah, but then slowly I started liking neurology. And then I realized that epilepsy is one subject which is multifaceted. It's not only medical treatment. There is enough psychosocial aspects of epilepsy. And maybe one can do something in that direction. And this doesn't need any gadgets. This doesn't need any money. What it needs is time, concern, and commitment.
So by the time you had finished training in neurology, were you already kind of interested in epilepsy?
Yes, I think so. I was already interested, and then Indian Epilepsy Association meetings I used to attend with Dr. Bharucha. And of course, Dr. K.S. Mani also inspired me a lot, I must say that, as far as epilepsy is concerned.
So when you cleared neurology and you became a neurologist, did you start, how about finding a job, and was it difficult in those days? Where did you start? No,
not at all difficult. For me, everything came on a platter immediate. One by one.
So where did you start your journey?
Senior registrar to assistant professor. But since I didn't want to
be in
position, and I was more keen on a practice and go outside as a honorary.
Okay.
I went to Nair Hospital.
Okay.
In 1977.
So in Nair, you went as an honorary, madam?
I went as assistant honorary.
Okay, so you could start your private practice.
Yeah.
And Dr. P.M. Dalal was honorary at that time, head of the department.
Okay.
Though
how many years in Nair?
7 years.
You want to tell us a little about that? What was...
Well, Dr. Dalal, another extremely nice person. Very abrupt, of course, at times, but intelligent person. He was interested in stroke, as we all know about him.
Yeah.
He wanted to develop a neurosciences to the research in stroke. He had collected the brains in each separate container for someone to come and do the research in stroke.
Brain bank.
Brain bank.
Yes.
And he had all the things that you require for research, including a Guildford spectrophotometer, which can even detect neurotransmitters in CSF.
Oh,
So, you know, he was fully prepared for that neurosciences. It's a separate building, neurosciences.
So you learned a lot from him then.
To get the CT scan brain in the entire municipal hospitals.
And you also said that from him, even your administrative skills got
I learned administrative skills. He always used to say that in corporation, pursue.
I'm learning that.
There are 6 copies of any proposal.
6.
He said, first copy doesn't work, second reminder, third reminder, so that you're pursuing your proposals. And that way you get the work done, which I learned, and I think it helped me in KM.
And what about practice, ma'am? You started private practice at
I
that
did
time. What
start a
about that?
private practice, but I think it was more of a, maybe in my own house I started, of course.
Okay.
Clinic and residence together. Maybe I used to work 2 hours a day, Monday to Friday. Practice was not really in that sense like making money kind of a thing and all. But it was just a pleasure to see different kind of patients. But let me tell you what helped me in practice was that I used to have a lot of patients which are referred by Dr. R.H. Mehta, who was a senior physician in Conway's Jain Clinic.
Yeah, you were attached that for many
Also
years.
helped me a lot. And he was from a diamond family, Dr. R.H. Mehta. I mean, Lilavati Hospital is his uncle's hospital.
Mm-hmm.
Diamond merchants used to be admitted in Jain Clinic, or R.H. Mehta would refer me the patients, from Diamond community. And that helped me later to get the donations from them for KM Hospital.
Okay.
Okay.
So that way the practice and Jain Clinic were very useful to me.
So now, ma'am, let's talk about, I think all 3 of us belong to our KM Department of Neurology, which you have headed for so many years, and you have installed so many new programs and new ventures which started under your leadership. So I can, the 4 which I can immediately say is a neuro ICU, which was started by you. And then there was a neuropsychology division, which was started by you, a neurophysiology, which was started by you. And the best part was the comprehensive epilepsy care center. So ma'am, tell us, how did you, have such a big vision, and how did you pursue to your dreams came true for this department? And we are really blessed, and I'm really blessed that I headed after you, and all of us learned in that department, which has got such good applications open for everybody to learn everything.
My transfer from NAR to KM was like a miracle in 1983.
Okay.
Dr. was retiring, and then I was called by Dean to take over the department. Let me tell you, I was very nervous that time. To be a head of the department and to go through all that, it gave me a stress, to be very frank. In fact, I went to Yoga Institute for 1 week to have a residential camp and held a little more. And let me tell you that Dr. Jaidev from Yoga Institute also has been one of my real good friend and mentor whenever I was finding some difficulty in life. So when I joined the department, since I was earlier there for 7 years, I knew the strength of the department. I also knew what are the lacunae of the department. So I remember in the very first month only, I wrote a letter to Dr. C.K. Deshpande that I'm interested to develop.
He was the dean, no? He was the dean.
He was the dean at that time, Dr. C.K. Deshpande. And I wrote to him that I want to develop this as a comprehensive epilepsy center, including surgery.
Oh, right then.
Yeah. Then neuro ICU. Now, why I thought of neuro ICU? There are 2 reasons. I always felt that we all learn chronic neurology as part of our MD training, but there is very little on acute neurology.
Yes.
So that time acute is sent to medicine department to start with. And when you start practice, you have to handle the acute first.
Acute neurology, agreed. Absolutely.
I mean, whether it's a stroke or epilepsy or status epilepticus or whatever. So we need some training in ICU for our students. And what triggered me was one lady patient of GBS got admitted in casualty. She had a respiratory distress. We needed a respirator, which we could not give because the respiratory department could not afford to give one respirator to our patients. And I said, why should we depend for treatable diseases to somebody? We should have, I think that's another trigger point, which made me really feel that we should have our own ICU, at least for diseases like GBS, myasthenia, or treatable infections, you know. That's how the whole work on ICU started. Third goal was to improve the neurophysiology. We didn't have much of EMGs in the department. And I requested Shubha Pandya to, you know, start teaching the students, which she agreed for once a week. And then it's Dr. Khushnuma who came. See, Khushnuma was a houseman with us. She was MD.
Medicine houseman.
Medicine.
Okay.
Yes. And but after doing neurology and medicine, she had a sickness and she was on leave for 2 years. And when she came back, she wanted to do something which doesn't have emergencies. And then I just told her that this is a new field. Why don't you take it? Neurophysiology. With little reluctance, but she said, okay, I'll start. And I requested Shubha to train her at Bombay Hospital. And that's how the Kushnuma got her training with Shubha Pandya.
And now she's a star.
I think she is the star. No doubt about that.
So, madam, one more person you have done is Dr. Urvashi Shah.
Yeah, correct.
Another star.
Now, see, for a comprehensive epilepsy center, clinical material was not a dearth.
Yes.
MRI had just come, which we need for our epilepsy surgery point of view, because the surgery was in my head all the time. Then therapeutic drug monitoring also started by Dr. Lilima Shivsagar.
Yes,
that's another big piece.
One more person who has really been helpful to in my life.
Absolutely.
Like, we started with level of phenytoin sodium. In fact, to start with, she said, I don't have reagents, madam, but I have HPLC. So I said, what to do? We put up a project in the Research Society. Dr. G.B. Palurkar was the dean. He sanctioned 10,000 rupees. We got the reagents and we started the phenytoin levels. That is how it started. And then, of course, she went ahead and started the entire clinical pharmacology department. And
now everybody comes to KEM for clinical pharmacology.
Yeah. Okay. So now the drug monitoring started. Now the neuropsychology, that's another arm of the comprehensive center. So Urvashi, after passing her, PhD, one day she comes and she had PhD on a memory, if I remember.
Yes.
Told her that you first give a lecture to my students, and she gave a lecture on memory. Half the things probably went.
Which was all bouncer.
I still remember. But then slowly I told her, why don't you start neuropsychology? And then in that small little dingy room of ward number 10, where we used to keep our records, cleaned the room, she got the room painted, and probably she started a neuropsychology there.
Remember, now it has grown into such a excellent support service that she is now, internationally creating, data and doing a lot of work now. And of course, Sangeeta's full support. So whatever seeds you sowed, and so rapidly you did so many different things. It's really amazing.
And to start with, it was an honorary post for her.
Yeah. Madam, it is
but her dedication has also been
difficult to find people like her.
Yeah.
So, madam,
what are the events?
And now what was remaining was a surgery.
So, madam, that's what I have to thank you for myself and Moinish. You told us, go and learn video EEG, go and learn pre-surgical evaluation, and you tell Moinish, go and learn epilepsy surgery. I think so. We both of us went, we learned, we came back. And I think your dream came true, was starting the epilepsy surgery at KEM.
And of course, Moinish
actually for everyone to watch. It has really grown.
Yes.
Epilepsy surgery in KEM now.
Yeah,
so they're really doing wonderful work.
650 surgeries, madam, is over. So
yeah, Moinish actually first video EEG he brought through the
Tata Trust.
Yes. And the Rabji Tata gave the first video EEG.
No, setting up things in KEM is such a challenge. I think that part you've, ma'am, really done so well. And now, everybody's carrying it forward. It's wonderful to watch that happen. So what are Sangeeta, anything else you want to mention about
I think ma'am, this thing, she organized the workshop and the conferences. I think, ma'am, what do you think, which were the most memorable events during your,
Yeah.
tenure?
Yeah, I
as
remember
a
a few.
epileptologist.
I'll tell you, I had heard Colin Binney in one of the international conference. And I thought he is the right man to come to India. Because everybody can't go abroad to learn. So, but if
Mhm.
international person comes and we do the workshop, then more people can get benefit. And I also felt that quality of our EEGs are very bad all over. We really are not good at our quality of the EEGs. We just like some graph on paper, and sometimes there are so many artifacts and one doesn't know what one is reading. And I realized this because I had gone to learn EEG with Professor Cobb at Queensware, London for 3 months.
Okay.
That was in 1979, and I knew what the value of EEG is. So I invited Colin Binney to make a workshop with us.
I'll never forget that workshop, ma'am. I realized that every EEG, the pediatric EEGs that we used to think were all abnormal, Zenobia came and told us they were all normal. I said, my God.
This is all hypnagogic. I also remember that.
It was a revelation. And I'll never forget that workshop. It was so useful and such a wonderful program.
It cleared our basics so well, I think.
Yeah. The other one was the project we did, ma'am. Sangeeta was also there. I was there for that genetics project.
See, this was a project which, one day we got a letter from Professor Delgado Ascuta from UCLA about his request for collaborating with him. We didn't know what we have to do, but still we said, okay, yes. And by that time we had one family.
Yeah, that was just coincidence.
5 generations had epilepsy, and in fact, the lady who had brought the first.
Yes, I remember her.
That in my family, now nobody comes and drinks water in my house because everybody thinks that all our family members have epilepsy. That stigma.
Stigma, absolutely.
And then we wrote to Delgado that we have this family. He just jumped on it, I think. He sent a lady and one doctor, first thing to collect the blood, and we had collection of 80% blood from 5 generations of that family. The entire family staying at Ghatkopar, and we had called them.
So I remember, ma'am, we arranged one hall somewhere to collect the blood.
And then next three months, we kept doing EEGs of all of them.
And sleep deprived, that also
sleep deprived
EEGs. And we had given them a video.
We used to give them food when they came, so that
and we gave them a video cassettes to see the movies whole night to keep awake.
Yeah.
And we made that huge family tree, ma'am. Do you remember? With sticking charts, 5 charts next to each other, and that huge family tree.
And then Dr. Delgado came for 3 days. He saw each and every patient himself. He saw each and every EEG himself. Then he carried the EEGs with me, and then to have a second review of the EEGs and then final, aspects of paper. I had gone to UCLA for 3 days in 1997 after attending the Dublin conference. And 3 days I stayed with him, studied everything. And then I think all his research, and he did find gene locus 8PQ published.
Who were your mentors in epilepsy?
Well, apart from Dr. Bharisha, of course, my real mentor, in my opinion, is Dr. Richard Marsland.
Who, ma'am? Richard Marsland.
He was a WFN president at that.
Okay.
Now, 1983, he had come to Bombay because he had to select venue for 89 World Congress.
Okay.
Be Bombay or should it be Delhi? So 3 days I spent time with him. I mean, he had gone to KEM, Nair, JJ. I used to take him around and all that. And I think he realized my interest in epilepsy at that time. And I also mentioned that I want to see MNI one day because there the epilepsy surgery has started. So, well, he must have registered in his mind. But after 5 years, in 1988, I received a letter from him saying that, Pravina, I have organized a trip for you.
Oh, wow.
And first week you come and stay with me. I'll take you to Colombia and everything. So 1 week I stayed with him in his house, which is WFN office. And he was vegetarian for 7 days because I was there with him. Then I went to MNI. He had arranged my entire trip. So I went to MNI for a week, saw even epilepsy surgery there. And then, of course, he sent me to Cleveland because there was some pediatric epilepsy conference arranged by Eli and Wiley. And then last he sent me to Tiffin Pendry Space at South Carolina. Used to have a mini fellowship program for 1 week. Because and that 1 week also gave me a lot of, the insight into the epilepsy. And so this is all because of Dr. Maslin. But Dr. Maslin told me one thing, Pravina, you have to spend your time in awareness and education to your people first. Let them at least comply with treatment, come for treatment first, reduce the treatment gap. Then comes the surgery. People won't come for surgery immediately.
Yes.
I think that was a trigger point in my mind to really start awareness, education, and all things. So he made me write one book on epilepsy for lay people. All that inspiration from him.
And as a resident now, we remember those 2-3 events because all of them happened when we were there as students. But the other thing I really remember is the lovely food we used to come and have whenever you're there, whether it was in the hospital side room, used to order those batata vadas from,
Or ma'am
across
will
the
get
road.
khakras from home.
Yeah. Or we used to come to your home so often. And those we used to really look forward to because we used to get to meet outside the hospital and, get lovely home food cooked by you and, at your home.
And my cook, Premji, I think you all remember.
Yes,
Of
yes,
course.
Wendy, we remember. I think every 6 months we used to look forward for a party at your home where after dinner we used to have people singing and dancing and everything together, I think. That was
Jayanti,
like a
What is your
family.
memory about residents and colleagues and what do you want to tell us also? Tell other, younger students and what is your experience with them? Because I think KEM gave you a variety of residents. Each must have been a personality of their own.
Anyway, before I talk on that, let me tell you my couple of other people who have also really inspired me. I think one is Dr. Singhal. Definitely, he has been a good support for me, entire epilepsy. He was a president of IEA Bombay chapter. And anytime you want anything, he has helped me. So that's something I'm very grateful. The other person whom I remember is Dr. Shashi Seshia, who was assistant honorary in KEM for 2 years when I was doing neurology. Another excellent neurologist. Of course, now he is in Winnipeg, Canada, pediatric neurologist, but wonderful person. Arjun Das has also inspired me a lot. Then Dr. Anil Desai was also a great help. He had sent me to Newcastle for a week when I had gone to London, and meet Professor Walton over there.
Oh, nice.
So, I mean, there are people who have been a great support all the time in my life, and both professionally, personally. So I'm really grateful for that. In fact, when I practice, I was hardly knowing anything, not even much confidence to have practiced. Dr. Singhal called me once and said, Pravina, do my locum for 2 months at Bombay Hospital. I was so surprised to do a Dr. Singhal's locum, whether I'll be able to do. But that 2 months gave me a lot of confidence in my life. So these are important things which one remembers and one feels very happy about it.
Yeah.
So I think...
who were your favorite residents, madam?
Oh, I'm sure.
Everyone.
See, I'll tell you. And of course, colleagues, I'll tell you the best period in neurology which we had when we were 3 consultants, myself, Dr. Nadir Barucha and Dr. Sorab Baba. I think we will never forget Sorab.
Yeah, that's how we were
with us, but he was a wonderful teacher. In fact, I wanted him to be the head of the department. And I wanted to be number 2 because I thought full-timer can make a department better rather than me as an honorary. I mean, that was my wish actually, but it didn't happen. So 3 of them, and then that time I had 3 students registered with him. So we had 3 residents and not 2, which every year we have 2. That particular year, we had 3 students. So Sangeeta, you were ahead of those 3 people.
Yes.
Jayanti, Abhishek and Abhijit and Vasudev. I think those 3-4 years were excellent. And I'm sure later on also there was very good residents. And I think I still remember Rajesh Deshpande as a very, very
Colorful
person. And Narayan, of course, and of course, lot of name. I mean, Hemant was the first one, and then
Sucheta,
and
Satish Nirale.
Nirale with Sangeeta.
Yeah.
And Manohar Deshpande.
Manohar, Vishwajit, all of them.
Then Makarand and Majid.
Makarand and Majid
They were
together.
just after us.
Yeah.
Then Yogesh Godge and Minal Joshi together.
Yeah. Yogesh Godge and all that. Right.
So I may be forgotten somewhere. Dinesh Kabra was there with us.
Yeah, I had left by then.
Nalin Chaudhary also.
Yes, of course.
Yes.
So lots of people I remember, and I'm sure they were all excellent people, and they have been a great, I mean, what you call support to me all the time in my life. And
so, Madam, other thing which I want to know, I remember as a student when I was working as a resident, you Saturdays after the epilepsy OPD, you used to call some patients and sit with them. And I think that was the place where your love for psychiatry was always there. So you started with the, I think, psychosocial aspect, which you always wanted to have for epilepsy patients.
Yes.
You know?
I tell you, it
How
started.
did that start, madam?
Yeah, it started with epilepsy clinic of KEM Hospital.
Yeah.
Epilepsy clinics, hundreds of patients, seeing agony on their face. Even though their seizures get controlled partially or fully, but still their issues are there. Education, marriage, employment, stigma. Father doesn't know whether to reveal about epilepsy to would-be in-laws or not to reveal. You know, there's a lot of dilemma in their mind.
Yes.
And so all this, when I saw, I realized that it's good. I think psychosocial management perhaps is the thing of the day. And I think one has to do it. Some time has to be spent. And what it needs is time, concern, and commitment. It doesn't need more money or gadgets. And that is how I think we started support group meetings. And one of the things, you know, we had a social worker full-time for the epilepsy clinic. So we already used to have a group meetings of patients. You remember?
Yes, yes, I remember that.
In the queue,
yeah,
our social worker used to talk to them in group. So
right,
that we were helped a lot to most
But
of
ma'am, after some time, you even moved these meetings to your home, no? Because
Yes.
I remember, because
Yeah.
I had moved out of KM by then, but I used to hear from you that you had it in your house or on the terrace. So, and then finally you managed to find some space where you could locate patients
Yes.
and have a, can you
Yes,
tell us
sure.
about that? Because that was a big
Yes,
challenge.
I
huh?
think
He said, yeah.
we
yes.
were wondering that we should have a place somewhere.
Mhm.
We conduct all these.
In Mumbai, getting a space is the biggest challenge.
Yeah, it's a big challenge. In fact, one of my trustee in Jain Clinic told me that, Pravina, when you take a vow to get a place in Bombay. And I took a vow that I will not eat ice cream till I get a place.
Oh my God. What a dedication, madam.
And believe me this. And then I think Nilima Shirsagar came to our rescue. She was the dean that time. So she had a good contact with commissioners. Department of Ratnakar Gaikwad, who was additional commissioner that time, to see him. And I started talking to him that this is the work we are doing and we want a place. He stopped me halfway and says, I want to listen to you carefully. So please wait, I'll finish other people. I said, okay. It was 7 o'clock in the evening. So he after listening to me, he says, yes, I want to help you. Come tomorrow to the education department and meet me at 9:30. Even if you have no time to type your application, bring a handwritten application, but you come tomorrow. So I reached 9:30. He made me talk to some people. After all that, he tells one person that you find a place for these people. And believe me, in corporation, within 15 days, we got a place at
Oh, wow. So you after 15 days, you had an ice cream then?
Yes, no, when we had an inauguration. That time.
Okay.
No, the ice cream had stopped for 3 years because she had
No,
to find
one and a half
Dr.
year. Let
1 and a half
years. Right.
No, we got an ice cream from Swati Snacks as a compliment of inauguration.
Yes, yes.
Right. So, ma'am, after that, this grew into a much bigger enterprise.
Yes, and that's because we were lucky to have a fantastic team. I think somewhere around 97, there was an entry of Kavita Shanbach, Carol D'Souza, and Dr. Urvashi Shah. And I think after that, all our activities started zooming in terms of awareness, education programs to different people, school education, education in community, education to paramedics, education to general practitioners, all that different programs we started.
You even made a movie, no ma'am?
And we made a movie. Movie was made much earlier by Shyam Benigal for us. It was a documentary film of 12 minutes. In fact, Shyam Benigal had come to ward number 10, sat with me and to study the epilepsy that time. He made a movie.
So, madam, then after this, I remember that you had a camp at one place in Bhagar, almost for 12 years, that rural camp.
Rural camp for rural patients.
That again was an inspiration from Dr. Dalal. One day he meets me and says, Pravina, all these activities you are doing at Bombay level and city level, what about the rural areas? Don't you think they need your help? I said, yeah. So I then approached Ashok Bhai, whom I knew, farmhouse at Pen, and his son had died of a head injury. That is how I knew him. And we had looked after the son during that head injury event. So he was as such sensitized with neurological, serious illness, epilepsy. So immediately agreed, yes, my farmhouse is open for you. You start the camp.
But ma'am, you continued there. I remember you saying that you hadn't missed a single camp.
Yeah, 12 years.
In 3 months. For 12 years, you didn't miss a single camp. I mean, that is some kind of a record. So what inspired you to continue to do that in one place?
No,
why did you do it?
We always used to give date to the patients in advance. No?
Yeah.
That time, see, for earlier 10 years, I would say, myself and Dr. Wagle used to manage the camp. Dr. Wagle from Jain Clinic, who is again a very devoted person. After that, of course, Dr. Joy Desai and Jayanti and Sangeeta, all of you started coming. And started.
I still remember you regularly would send patient for surgery. You will find from there, and I've operated those patients at
Yes, correct. From the camp we used to find.
Yes, I remember.
We had organized a lot of things over there to do the blood levels of the patient with one pathology, to do the MRI with some MGM hospital, and all that organized things were done. And the hospitality of Ashok Bhai and Naresh Bhai was fantastic. It was a picnic for us in a way.
So not only did you do, medications, but I think even there conducted some awareness activities and all of that as well. So one more thing is that you also gave a platform to so many patients to become international ambassadors for epilepsy.
Yes.
They attended international conferences and used to create those kits and perform them in our IEA as well. So you want to tell us a little about
Yes. Actually, the first person who came with me, international conference, Taiwan, was Carol D'Souza.
Right.
I took her with me, and there she spoke extempo. And President was really impressed by her. And that opened the doors for Carol D'Souza to attend national, international conferences. And today, she's one of the most, prominent ambassador of epilepsy as far as we are concerned.
She's done a lot of work.
And she has done dedication to our Samman like anything.
So many years she has been regular there in Samman.
Yeah, and Kavita Shanbag and Ignatius. I took with me to Dublin conference.
Oh.
They both had come. So this is how, I used to take people with me, and then they started.
Yeah, ma'am. You have empowered so many patients, I think, not only like this by giving them platforms, but also, in their own personal lives. You've been like their, go-to person for any problem, as Sangeeta rightly said, almost like their mother. And how many times in your home you have taken care of them. So many events you've done with them, gone on picnics with them. The kind of dedication you've shown is, it's seen to be seen to be.
But I'll tell you at the end of the day, what I feel, that when I see these patients smiling, laughing, dancing, in spite of all their problems of seizures and no employment and all those kind of things, when they smile, I think it makes your day. So at the end of the day, I feel we are not givers, we are takers. We forget our own woes.
So, ma'am, you've also got some awards. We also want to hear about that. I think you got the International League Against Epilepsy Ambassador Award, right? Which year was that?
Actually, I got a Social Accomplishment Award.
Okay.
2018, 2011. And I had gone to Rome to receive it.
Yes. I was there with you, madam, in the hall.
You are there.
Yes.
And this is, I'm the second person in 50 years in India to get it. First was Dr. K.S. Mani.
Okay.
Also, you were, madam, president of Indian Epilepsy Association. You were president of Indian Epilepsy Society. So I think you were heading the two national bodies of epilepsy for some time. So what do you want to say on IEA?
I think I enjoyed my term as president in both the associations. But let me tell you, the person who has helped me quite a lot in this IEA and also helping our Bombay chapter, like to sponsor our people to attend national conferences, international conferences. This, so they have a IEA trust has helped us a lot. And that was Dr. Vinod Saxena, who was very helpful to IEA Bombay chapter. And another person who has been very helpful to me is Dr. H.V. Srinivas, who has been a good friend as far as IEA and IES is concerned. So I think those two people and of course so many other people also. It was a very nice association with people like Vengamma and Gagandeep and all those people,
Sangeeta, you want to
And I'll tell you another person who has been also, of course, in epilepsy camps and all is our Dr. Nirmal Surya.
Yes.
Epilepsy Foundation, which is also doing a lot of work. So I think a lot of camps going on, but everybody has a different model as far as the camps are concerned.
So, madam, what was your journey after you retired from KEM?
Yes, after I retired from KEM, one thing, see, I have been associated with the Spastic Society of India.
Yes.
1977. So maybe my work with their parents, children and everything, increased a bit after I retired. So I spent a little more time with them. I was also earlier associated with Jai Vakil Institute of Mental Retardation. But then, of course, I got attachment to Wokard Hospital or now a Fortis Hospital. And then now I'm here for last 16 years. So
really?
16 years. I changed my residence to now, the Bhandup.
Closer to the
hospital. In any way, all these activities, the support has been a lot from my family, no doubt.
Yes. Madam, what do you want to say about Usha Kanbai? You have to say something about Usha Kanbai.
Well, we know each other since we were school children.
Right.
Oh, really?
Staying in the same building.
Oh, okay. So it was a romance from
Yeah.
School days.
Yeah. And then, of course, we just developed the relationship, and they were also middle class. We were also middle class people, and, but still we supported each other. And he was one person who supported me throughout for all my activities.
So he was the man behind a successful woman.
Yes.
He was the man behind a successful woman.
Yes, no doubt about that.
Absolutely.
Extremely supportive. And even my in-laws.
Yes.
My mother-in-law was excellent person.
I used to meet your sister Indri and your brother also.
Yeah, they are extremely supportive. My entire family, I'm blessed with a good family and friends and wonderful students.
So, ma'am, you've gone through, when Sangeeta mentions to me, and I also know that you've had your share or more than your share of stressful times, whether it's at work or personal life. But still, you've always been so cheerful, smiling, and never give up. I mean, I've never seen you, losing your poise ever. I mean, maybe you did privately, I'm sure. So, what is the strength? What is the secret of that strength?
But I must tell Jayanti, she's a fighter.
Ah,
I mean, I know madams very closely, and then I know that such downs she had in life, but she fought back and she came back to what she is today again. And we also want to know, madam, what is the secret of energy
that's
at
strength.
this age
And that's
also?
strength.
You are still doing a camp. You're still going for the camp. I still see the Samman group, and 11th September, again, you're going for a camp. So, I mean, what keeps you driving, and how
I
do you
think it's,
manage the stressful events?
I think the smiles and blessings of the patients, very important. And I think my faith in God. I have read a lot about Vivekananda and so many people earlier in my life. And there is one thing which I remember, which Vivekananda had always said, no power can withhold anything one really deserves. And I think that's very important. Whatever you deserve, you will get it. Whatever you don't deserve, you will not get it. But you keep continuing your work. So I think that keeps me going. And I think it's the students and residents. I feel their love and affection is an elixir to you when you're growing old.
Absolutely.
I remember one sentence which Dr. Narielwala wrote to me in one of his letters, which I would just read out. It has always been my experience that the friendship, loyalty, and affection of the students and residents make up most abundantly for the hardship and vicissitudes of the senior clinical and administrative responsibilities.
Right.
I think
Absolutely.
that has always given me a strength that without residents and students, no one can do any work. But as a teacher, what I would say that when it comes to work, I think one should be strict with the students because they have to learn. And all neurology students must remember that spending time with patient is very important. Your history taking and your examination, your counseling, and your building rapport with the patient is the most important thing in life. So spend enough time and God will always give you what you want. But if you just hurry up everything, just in 5 minutes, you want to just finish every patient, it doesn't work. So spend the time with patients is very important. And you always learn from patients also a lot, many times. But they have going through it.
So, ma'am, this is the message for residents, but what is the message for our epilepsy patients? I'm sure they will also see this program because they all
And I
adore
think
you,
the
ma'am.
epilepsy patients, the most important thing is a compliance. Compliance of lifestyle, compliance of anti-epileptic drugs, and they have to grow in life, whatever they can do. See, I think one quotation we wrote in our ECEL, which we tell our patients, that also I will read out because I like it a lot. If you can't be a sun, be a star. If you can't be a highway, be a trail. If you can't be a river, be a brook. It's not by the size that you win or fail, but be the best of whatever you are.
Wonderful, wonderful, ma'am.
I think it's written in our ECEL.
Yes, I
Yes,
remember.
I
That was
remember.
in the entry, there was a board in
Yes.
which was a frame was there.
Yeah. So I think these are the important things in life we all have to learn, but very important. One other good luck that I have that we have very well-wishers and donors for us.
Absolutely.
Them.
Yes.
Our association is running on donors.
Yeah.
So
As though I have become 60, I still know, whenever I have a crisis, I still call you up, madam. You know that. And you are always there to guide me and tell me, pacify me, bring me to the normal level. So as I remember my mom, in a professional crisis, I remember you.
That's so true. I mean, ma'am has been our friend, philosopher, guide, much beyond the realms of neurology. And she has led by example, I must say. True
Yes.
dedication to work and to patients, and with a cheerful spirit. I've never seen her feel, that why I have to do this or why do I have to do that. I've never, ever seen her do that. I think that's the biggest learning I have from Dr. Shah. Because I think we all know to use medicines, we all know to read up, we all know to treat, but the attitude of caring is something we all have to see to learn, and we have seen that with her, and my respect for her for that always. So I wish that we all retain that spirit that we have learned from you, and it should not fade. As you said, even if you can't be the light yourself, at least you can reflect it.
So
Yeah.
as
I hope we can
at
do
the
that.
end, I would say that I felt always that there are 5 female gems in Bombay as part of, I mean, KM products or whatever you call it. It starts with Carol D'Souza, Jayanti, Sangeeta, Urvashi, and Kushna. Each one has done excellent in their own field, whether it's neurophysiology, neuropsychology, epilepsy surgery, psychosocial aspects. So I think blessed with that. And one more thing which I'm blessed is also my niece Saranga, who is with me. I think it's a good company. She's very caring and loving. So now in today, I mean, I'm not feeling alone. I don't feel lonely. I feel there is a good company with me. And that's also a very big blessing for me. Carol always used to tell me, ma'am, you have got a ready-made daughter.
Yes. No, I understand. So I think we just hope that we remember your teachings for all rest of our life. We have remembered till now also. And whatever we have learned, we may be able to calculate the same thing in our students. So that's what I think I and Jayanti would love to do, that our students also learn the same thing which we have learned from you. And we pass on that legacy to our students also.
Yeah, and I hope that tomorrow, like in future, somebody else will interview you as legends of neurology.
Hopefully.
Ma'am, I hope we are able to do some work like you did before we deserve something like that. So thank you so much, ma'am. It has been a wonderful evening of chatting with you. And as I said, everybody would agree it was a nice conversation mixed
Absolutely.
with
Really
a
enjoyed
lot of anecdotes.
I
And
enjoyed
ma'am
it
has
thoroughly.
such excellent, vivid memories of each of these. Narrates them with so much of life that it's always a lively conversation. So with this, we will end this chat for now. And all the best to you, ma'am. And we hope to keep learning from you.
Thank you.
Really
Thank you,
enjoyed,
both
ma'am.
of you. Thank
Really
you.
best of luck for your rest of the life. And we are
Okay.
always together whenever
Okay,
we
okay.
need you.
So best of luck to everybody and namaste to everybody.
Yeah.
Thank you, Sangeeta.
ma'am.
I
Thank
think you made it so lively chatting
I
together.
think our combination worked well.